I'm Lisa, a registered nurse here with Precision Advanced Specialty Healthcare. Today I'm going to demonstrate for you how to change out your patient-controlled analgesia medication. If your doctor has ordered a PCA pump for you for home pain control, we will see you in the hospital and connect you to the pump before you leave the hospital. We will also give you a teaching sheet like this that has detailed information about your medication and about the infusion. What I'd like to go through is what you need to know to be able to change out your medication when your pain pump runs out. You will be given a backup pump, so you can get your pain medication ready by attaching it to your backup pump and then connecting it to your IV line as soon as you disconnect the old PCA pump. So we're going to begin by getting our supplies together. We need our backup pump, we need a battery, we have a saline flush, and some alcohol pads, and then we need our new cartridge or pain medication. We will make sure that we deliver a new cartridge for you in ample time so that you will not run out of pain medication at any time. If at any time you notice that you're running low and you do not have a backup cartridge, call us and we'll make sure that you get one as soon as possible. The backup cartridges do need to be kept in the refrigerator until they are attached to your pump, and you will need to take them out at least an hour before you attach them for them to come to room temperature. So in order to get this new cartridge attached to my pump, I'm going to begin by opening up the battery door. There is a white button that I'm going to press and the battery door comes off. Battery will only go in one way correctly. If I press it in and I hear noise, then it is correct. I will slide the door down, and once I've done that, my pump will go through its initial setup process. It takes it a few minutes to go through all the settings that have been put into the pump to make sure that it is ready for you. All of the settings will be specific to what has been ordered for you by your doctor. As far as the pain pump goes, your doctor will normally order a basal rate, which is a rate or a number of milligrams that will be given hourly. That will be a continuous infusion. And then you will also be given a demand dose. Demand dose is a number of milligrams that you will be able to be given on an intermittent basis. On our pump, there is a dose button. You will be able to press the dose button every number of minutes that has been prescribed by your doctor. If you can have it an extra dose every 15 minutes, then it will be 4 times per hour. We will make sure that you know how many times per hour you can press your dose button and how many milligrams that dose will give you. Some patients just use the dose button here on the front of the pump. We also have a handheld dose cord that can be attached to the side of the pump, and you can use that just like the patient-controlled analgesia pumps in the hospital. Once the pump goes through its complete setup process, you notice that it's in PCA mode and currently it is stopped. You know that it is stopped or not running because this amber light is blinking. So now we are ready to get our pain medicine ready to be changed out. We will need to attach our new cartridge to our pump. And we're going to do that. Okay, now we're going to attach our new pain cartridge to our backup pump. On the bottom of the pain cartridge, there are 2 plastic feet, and on the bottom of our pump, there are 2 metal feet. We're going to place those plastic feet underneath the metal feet, and then we're going to tightly hold the new cartridge against the pump. We want to turn this key from horizontal to vertical. We're going to do that by using the side of our CADD pump key. Place that in, press it down, and turn it until it is completely vertical. If it's in the correct place, it's going to say that the reservoir is latched. Now it's going to say that I need to lock the cassette. To lock the cassette, I take the bottom of my CADD pump key, place it in this hole here, and turn it to the left. That locks it, and it tells me on my pump that my cassette is locked. Now it says press next to continue. If I press next, it asks me if I want to prime the tubing. This tubing has already been pre-primed by my pharmacist, so you do not need to prime it. So anytime it asks you if you want to prime the tubing, you're going to say no. Now it asks me if I want to start the pump. I can't start my pump until I've attached my tubing to my IV line. So here's our IV line with our current pain pump attached. We're going to disconnect our current pain pump. We've already turned that pump off. We want to make sure to clean the end of our IV line before we attach the new tubing. So we're going to clean all around the sides and in the center, 10 to 15 seconds, using a scrubbing motion. Then we're going to pick up the end of our tubing, take the protective cap off, and attach this to our pump. We're going to attach the IV tubing to our hub by pressing it in. There's a little spongy part in the center. Press in and turn to the right. So you're going to press in and turn to the right. Make sure it's snugly attached so that it doesn't leak. Now that it's attached, I'm going to make sure the clamps are open on my pump. If I leave these closed, my pump will give us a high pressure alarm, so we don't want to leave any clamps closed. We also want to make sure that nothing is crimped. Now that I have it attached and the clamps open, it's asking me if I want to start the pump. I'm going to say yes. And my pump begins the startup process. It again is going to walk through all the settings that have been put into the pump by my pharmacist. Once it has reviewed all of the settings, we're going to see this amber light become a green light. And we will notice that it is in what we call the running mode. So we would know our pump is working. Give it just a minute. Now it is running. We're in pain pump mode. And anytime you want to give yourself a dose, you will press the dose button and hold it down, and it will give you a dose.